Hey everybody, we are back for another Monday Miracle here at Bright Beginnings. And for this one, we are talking about our youngest little baby, our youngest practice member, who is a whole whopping 7 weeks old and was right around 3 weeks old when she first came in. And if you haven't seen our Monday Miracles before, we pop on here every Monday and just chat about some wins, some awesome things that are happening at the office for kids or for families. And so, like I said, this little 7 week old, and so many people might think, why would a 3 week old need to go see a chiropractor? And the biggest things, there were really three of them. And these are the things that every single baby should be doing as well as possible. It's eat, sleep, and it's poop. And she was struggling with all three. So they brought her in. She was just very obviously uncomfortable. She was stiff a lot of the time. Was really irritable, lots of crying, not sleeping very well. Digestion was always super painful, to the point where she would scream and cry and oftentimes even turn red or turn purple because she was just really struggling to work through it all. So they brought her in, and these are all things that we help with all the time. And so when they brought her in, the first things that we talk about, or ask questions about, I should say, is we're looking for areas of when did stress enter this little baby's nervous system. Now, obviously, only being 3 weeks old, there's really only a couple things that it could have been. The first is stress during pregnancy, which there was definitely stress on mom during pregnancy. And the reason why we're curious about this is because mom and baby are directly connected through the umbilical cord, right? That umbilical cord is the power cord. And so when mom's nervous system is going into stress mode consistently throughout stress, and there was a few different things that happened that we talked about. Baby doesn't necessarily mean all of a sudden baby's going to have struggles for sure, but it just sets their nervous system up to be more comfortable or more susceptible to veering into more of that stress mode as well. And the reason why that's important, veering into stress mode, is because eat, sleep, and poop are all things that need to be done when the nervous system is more relaxed. So if they're spending more time on that sympathetic stress gas pedal side of the nervous system, then they're going to struggle to do the exact things that she was really struggling with, and the things that so many babies that we see in the office struggle with. And the other conversation we had is, how was birth? And this is really where the tough part for her came in. They went in the hospital, things were seemingly moving well, but then everything kind of just slowed. There was no real progression. So, when they were in the hospital, that then leads oftentimes to induction with Pitocin, which is the route that this started to head. And then even that wasn't really working well. So then they tried a vacuum extraction, which is where they put, like a big old plunger, lock it on the baby's head and try to pull him out. And that didn't work as well. And so you can imagine, and then, again, because that didn't work, it then ended up being a emergency C-section that wasn't the easiest as well. So lots of physical stress on a really, really important neurologically and also structurally part of this little baby's body is way up right here in the upper neck and head region. And the reason why that's so important, right? And they were with the induction, Pitocin, lots of contractions, putting compression onto the head, and then with the vacuum extraction, pulling and twisting, for lack of a better term, injuring this area. And the reason why that area is so important is, neurologically speaking, all the nerves there, they come right into the face, right? So it controls the latching, it controls the feeding. This babe had also had a tongue tie before she came, a revision before she came to see us. The nerves up here also is right where the vagus nerves start. The vagus nerve is one of the most important nerves for a calming influence on the body, as well as with digestion. So when there is irritation, stress, tension in that area, all of a sudden now all of these important functions from the neurology point of view start to struggle. And so we ran our nervous system test, and sure enough, we found, yep, she's more into that stress side of the nervous system, that sympathetic dominant side, and there's definitely some stress holding right up here, and she had some in a few other areas as well. And so we very effectively and very gently started to remove that stress out of her system with our adjustments. Sometimes she even sleeps right through them. That's how gentle and easy the adjustments are for these little babies. So, she is all of a sudden doing a whole heck of a lot better. We just redid her scan. She's about a month into care now. The cool part about working with these little babies is things start to happen really fast. So she's feeding great. She's latching well. Digestion is really well. Still a little gassy, still working on some reflux, but overall, totally different baby. Comes in, very minimal crying, super comfortable, sleeping 3-4 hour stretches super consistently, wake up to feed. Occasionally she gets a 5-6 hour stretch. So of course that's great on mom or dad. So awesome improvements. And the key is early intervention here with this little baby. So if any of you have those little babes out there, bring them in early, get them scanned. We'd love to help. Happy Monday.